Good afternoon, and thank all of you for being here today. I'm going to start with some information, an update on the weather and Hurricane Laura recovery. Then we'll get to the COVID briefing. I had with me here today Dr. Guidry, who will be available to answer questions on the public health emergency as well. Today is the first day of October, and this also marks the last month of hurricane season. And so I just want to remind everybody that we still have a month to go, and we can't let our guard down. We are currently monitoring 2 areas of low pressure that could develop into tropical cyclones over the Caribbean, and that could happen over the next 5 days. Currently, we don't expect impacts in the northern Gulf Coast area, but it's too early to say what will happen after the 5 days is up. So we're asking everybody to be weather aware and to have a game plan for this last month. Even if you've gotten all the way to now and for some reason you haven't done it yet, get a game plan for yourself and your family. The plan is different in a COVID public health emergency. So go to getagameplan.org to make sure that you're prepared for bad weather. Obviously, we continue to recover from the devastating impacts of Hurricane Laura. To date, FEMA has put nearly $148 million in the hands of survivors, including almost $101 million for housing assistance. Additionally, the U.S. Small Business Administration has approved $186 million in low-interest loans to help Louisiana hurricane survivors to recover. The deadline to register for FEMA help is October the 27th, so we have less than a month left for that. I encourage people, if you haven't yet registered and you've been impacted by Hurricane Laura, to visit disasterassistance.gov, or you can call the FEMA helpline at 800-621-3362. So that's disasterassistance.gov or 800-621-3362 in order to get more information or to register for disaster assistance with FEMA. An update on the Blue Roof program. To date, the Corps of Engineers, through its contractors, has installed 6,241 temporary blue roofs. New applications for blue roofs cannot be made because that application period ended yesterday, but the Corps will continue to do the work to put the roofs on all of the homes that have been registered and that are eligible for the program. The Louisiana Workforce Commission is extending the application period for disaster unemployment assistance, and it's commonly referred to as DUA. That will go through the end of the month, to October the 30th. This is for eligible survivors of Hurricane Laura who either lost their job or their employment was interrupted because of the storm. They should register for DUA at laworks.net, laworks.net. Due to the continuing impacts and effects of Hurricane Laura, DCFS will again issue SNAP benefits early, and they'll do that today for current recipients. And there's also been an extension of the hot foods waiver that allows SNAP and DSNAP recipients to use their benefits to purchase hot or prepared foods from retailers in Louisiana where EBT cards are accepted. That waiver will last through October the 31st. It was originally set to expire today, so we want people to know that it's going to last through October the 31st. As of this morning, we continue to shelter 8,683 individuals in Louisiana. An additional 3,584 are being sheltered in Texas hotels. All of these shelters are non-congregant shelters, hotels, and hotel consolidation efforts are underway. Both in Louisiana and in Texas, working through the American Red Cross and state partners. And we are moving people home as we are able to do that and fully coordinating those efforts with local authorities in the parishes from which the individuals evacuated. For anyone planning to return home, please continue to follow guidance from your local officials on reentry. We know that power is still out in some areas. Principally, that's Cameron Parish with most of the current outages. There are about 6,000 customers still without electricity. Cameron has the most of that. Calcasieu has most of the rest of that. But we're encouraging people to make sure that if they are using a generator, to please continue to operate it safely following the guidance we've been giving, which is keep it at least outside and at least 20 feet away from your house. Don't put it underneath a window or a vent, not in the garage or crawl space, certainly not in your house. And then when you refuel, make sure that you allow the generator to cool down for at least 20 minutes before you refuel it. On the flip side of the weather, we have started to get our first taste of cooler temperatures. So if it gets cool enough to require heaters, please make sure you keep those portable heaters at least 3 to 5 feet away from combustible materials like blankets and comforters and so forth. No one should use a kitchen oven in order to heat homes. Don't leave open flames like candles or fireplaces unattended, and make sure that there are no combustibles near those open flame type of heating methods. Smoke alarms and carbon monoxide alarms truly do save lives, so check to make sure that yours is working and that batteries are fresh. With respect to COVID, we are reporting today 608 new cases, and those cases are from 16,141 new tests. In the month of September, we administered 444,390 tests. This is obviously down from the previous month. It is still well over twice what our minimum goal was, but we suffered a couple of weeks where we had really reduced testing because of Hurricane Laura and the community testing that was interrupted across the state. And we are working really hard, in fact, have since the hurricane hit to reinstate all of the community and surge testing that we've been doing around the state of Louisiana. And we encourage people to continue to take advantage of the opportunity to be tested. We also know that there are rapid tests that are be coming from the federal government, which we very much appreciate, and we will deploy those in areas of need with respect to increasing the testing. Sadly, we're also reporting 8 new deaths today for a total since the beginning of the public health emergency, 5,329 deaths. And periodically I like to make sure that we remember that these are not just numbers, these are people. So those 5,329 individuals were people's brothers and sisters and mothers and fathers and aunts and uncles, grandparents, children. So let's keep them and all of their families in our prayers. Some good news today on hospitalizations. There are 534 patients hospitalized across the state with COVID-19. That's a decrease from 19 from yesterday. There are currently 75 individuals on mechanical ventilators. That's down 4 from earlier this week. And so we made some progress there. In fact, our hospitalization numbers are down to the levels that we last saw in early June, just before that second surge really happened. We know it's critical for people to continue with our mitigation measures. The reason that there's been a lid on the cases and decreasing hospitalizations. And finally, we're seeing some low number of deaths too, but it's hard to talk about any number of deaths, including the 8 today, as being acceptable. But we're seeing decreased deaths as well. This is all due to the mitigation measures and the restrictions that we have in place. So I do want to encourage everybody, especially as we get into flu season, and we'll talk more about that in just a moment, to make sure that you follow the mitigation measures. They're critically important. Wear your mask or other face covering. Make sure that you social distance with at least 6 feet between yourself and people who are not part of your immediate household. Wash your hands frequently and stay home when you are sick or show any of the COVID symptoms. So you may not be sick, but if, for example, you lose your sense of taste and smell, first of all, you've then got a symptom. You really need to go out and get tested, but please stay home. More parishes are obviously qualifying to opt in for bars opening under the restrictions that we have in place, and the vast majority are, in fact, electing to opt in. So I just want to spend just a minute on what those restrictions are. First of all, only parishes with 2 consecutive one-week periods of 5.0% or less in positivity, as identified on LDH's website, can opt in to allowing bars to resume on-site consumption with those mitigation measures and restrictions in place. The data on the website is already rounded to the nearest tenth, so there's not any additional rounding. If a parish opts in, it will be allowed to open the bars to on-premises consumption until it hits 2 consecutive one-week periods of 10%, again, as identified by LDH. And we would hope that that never happens. LDH updates this data weekly, and that happens on Wednesdays. Anyone can access it by visiting ldh.la.gov/coronavirus. Also want to remind the owners to review what their operations need to look like under the order, including table service only. Customers have to remain seated. No service at the bar counter, and the 11 p.m. closing time. In addition, no one under 21 can be in the bar as a patron. As bars open, I especially want to appeal to young people to be very cautious. We saw outbreaks linked to bars back when they reopened on-site consumption last time. This was driven largely by younger patrons, and right now, people who are under 29 account for about 40% of all new COVID cases, and those from 18 to 29 are about 20% of new COVID cases. So even if they don't see major COVID complications themselves, obviously what can happen and what did happen in Louisiana and elsewhere in the country, principally across the Sun Belt after the Memorial Day weekend, was that young people really drove those increased infections across the entire spectrum of the population. I encourage anyone who is at high risk, who is vulnerable to this disease, to remember you're always safer at home. And when you do go out, please avoid crowded or busy situations. So if you are over 65, if you have a serious health condition, consider minimizing your outings and staying home whenever possible. Even though we're in phase 3 because we met the gating criteria, there is still an awful lot of COVID out there. We have people who are out and about, obviously, but we're also going into flu season. So it is more important than in any previous flu season that I'm aware of that people get their flu shots. Even if you don't typically get them, please get flu shots this year, because the degree to which we can keep down the spread of the flu, that will help us tremendously in our hospitals, because it is a respiratory disease. Like COVID, and individuals with flu and COVID put demands on the same part of our healthcare delivery system. And we don't want to overwhelm the capacity of that healthcare delivery system. So obviously the flu shot won't prevent COVID, but it does help when it comes to making sure that we don't overwhelm our capacity of our hospitals. I'll be getting my flu shot next week. And it's also good to remind people that the same mitigation measures that reduce the spread of COVID also reduce the spread of the flu. So wearing your mask or your face covering, staying physically distant of at least 6 feet from individuals not part of your same household, washing your hands frequently, staying home when you're sick, all of these things are incredibly important. A couple of other things before I take questions. The last day to complete the census is now October the 5th, and I know there's some litigation and that date may slip again, but previously it was September the 30th, and so some people may think that their deadline for them to respond has now passed. It has not. The current deadline is October the 5th, and we cannot assume there will be a further extension, so we're encouraging people now to respond to the census if they haven't already done that. Anyone and everyone in your household should be counted. That includes babies, children, adults, college students. Our response rate thus far is 95%. That lags behind most of the rest of the country. So we still have some work to do, and we have until the 30th to get it done. It takes 10 minutes or less in order to respond, and this will impact our funding over the next 10 years for things like education, healthcare, transportation. It will inform the decisions that get made about redistricting, whether it's the state legislature, the Supreme Court, Public Service Commission districts, or the representation that we have in Congress. So it's really important that everyone be counted. You can go to my2020census.gov in order to respond to the census. The last day to register to vote in person or by mail is October the 5th. So if you're not registered to vote and you want to participate in this upcoming election, the last day to register is October the 5th if you're going to register in person or by mail. If you are going to register online to vote in the November 3rd election, the deadline is October the 13th. For more information, you can go to govote.com. And I think most of you know this, but go is spelled the Louisiana way, G-E-A-U-X, govote.com. Okay, so I will pause here and take some questions. I'll go ahead and announce the next scheduled press conference will be Thursday of next week at 2 p.m. If we have a need to address you before then, we certainly will do that. Yes, sir.
Governor, when you originally opened bars in the spring or summer, they were also limited to table service, where they were supposed to be, and they were also limited to 25% capacity. And it seemed like a lot of them didn't really follow those rules, or if they did, it just didn't work. And you obviously closed it back down for that reason. I'm wondering what's different this time. And why this will be successful the second time around?
Well, because for several reasons. One is we've now tied it to the percent positivity. So there's reduced community spread before they ever open their doors for on-premises consumption. Secondly, there is a limitation on the hours they can operate, so that they have to close at 11. That had success in other states. And then until you're 21, you can't be in the bar. And that's going to be really helpful because now that we are back with students on our college campuses. So for all of these reasons, it is a safer way to open. We were able to learn from what other states had done. We looked at guidance that was being provided by the White House Coronavirus Task Force, for example, where they were tying the ability for bars to open on-premises consumption to that percent positivity, which really is an incredibly important thing to do because the degree to which you have community spread obviously means the degree to which you're going to have spread inside certain venues. And so if you can get that down, and also I think everyone can see now, and by the way, we talked about this with respect to other things as well, but that percent positivity is really, really important if we're going to do better. And so you look at the percent positivity, you look at new cases, you look at hospitalizations, all of it. But the first sign that you're either doing better or worse often shows up in that percent positivity.
Like Tigerland, for instance, was a big hotspot. LSU students who are over 21 can now go to Tigerland. You're comfortable with that being allowed?
I am, yes. If I wasn't, I wouldn't allow it, right? And it's subject to these restrictions. And we are obviously asking all the bar owners to be conscientious and be prudent and safe. And also we're going to be enforcing as well. And so if they will abide by these restrictions, the 25% occupancy, the tabled patrons being served, only if they're sitting at tables, I should say, and the closing hours of 11 o'clock and so forth, I do. Yes, ma'am, in the back.
Okay. Dr. Alex, you told the advocate that he didn't think stadiums should be open and that he thought it would increase the number of COVID deaths in the city. I wanted to know whether he had expressed that to you, and if so, why did you decide to move ahead with opening them at 25%?
Yeah, I don't recall that he ever expressed that to me, that he didn't think they should be open. Obviously, he and I have had a number of conversations over the last however many months. It's been 7 months or so. And if I have forgotten it, I apologize. I don't remember any comments to me about that. But I will tell you, I have valued his counsel, his knowledge, and so forth as it relates to the way we've handled our public health emergency in terms of the decisions we've made about restrictions to impose or to relax, and doing those as best we can based on the data and the science and the guidelines coming from the White House. But I think it's safe to say that the degree to which you have any venue that's open, you're gonna have more people there coming into contact with one another, and you increase the risk of the disease being transmitted. And so I think what he said is basically true for every venue. And my perspective on this has always been to try to strike the right balance between the public health imperative on the one hand and having our economy open on the other. And as I mentioned before, no matter where you strike that balance, there are going to be people who are on either side of it who say, well, you've gone too far, or you didn't go far enough, or you went too soon, or you waited too late. We've done the very best that we can. And one of the reasons, I'm aware that if you have a large number of people who are gathered together, that's not as safe as if you don't have that. But if you limit the capacity of these stadiums to 25%, and you put crowd managers in there, and you make sure that people are masked and physically distant and so forth, I believe it can be done safely to the point where we can and should have them open at 25%. Yes, sir.
I was just trying to get your opinion about these, I guess you call them review committees that are passing, that are going through both houses of the legislature, that will have lawmakers have more of an input when you declare an emergency, up and including terminating this current pandemic emergency.
Yeah, well, first of all, everybody should know that I've been fully informing the legislature all along on what the data is, what the guidelines are, and what decisions are being made and why. That particularly applies to the work that I've done to communicate with the Speaker and the President principally, but other rank and file members of both the House and the Senate as well. And so we're in this special session. We're going to see what bills pass, what don't, and eventually what they look like. And it's really too early to know what any particular bill is going to look like as it hits my desk. And as I always do, I reserve the right to pass judgment on a bill when it comes to me so that I can see exactly what it looks like. I will tell you it is not a good idea to try to manage an emergency by committee. And I hope that is not what the legislature is trying to do. The legislature has always had the ability to provide oversight. They call committee hearings, and so it's something that we're accustomed to. And as a legislator, I did it myself, and as governor now for almost 5 years, we've routinely engaged in committee meetings for oversight. So having a formalized structure as it relates to a public health emergency, for example, where we go share information with the review committee, I don't know that that's a problem or not until I see exactly what that looks like. But we're going to work through this process, and we'll make a determination about the bills once they come to my desk. Yes, ma'am.
On that same topic, Governor, a lot of the criticism this first week seems to be about communication. And I keep hearing, as we all have, that legislators don't feel like they've gotten enough information. They don't feel like you have been communicating to them, and you are saying that you've been fully informing them. Can you talk more about what you feel you've done to reach out to them and why you think you've done enough there?
Well, first of all, when a legislator says that, they're also, many of them, saying they don't want any mitigation measures or restrictions to be in place. So it's not about the communication, it's about the decisions that have been made. And quite frankly, there's not a reasonable discussion to be had with people who believe right now in Louisiana that we shouldn't have a public health emergency in place, or mitigation measures in place, or restrictions in place in order to slow the spread, protect public health, to save lives. Now, we have had weekly calls with legislators. I have answered the phone, returned phone calls. I've met with any legislator who wants to meet with me. I think before every single decision on whether to stay in a particular phase or to go to the next phase of reopening, we have gotten data in from the Department of Health, analyzed it, and then I have met with, or at least spoken by phone with, the President and the Speaker about what that data looked like, applied it to the guidelines, and told them why I would or would not be moving to the next phase, and then give them an opportunity to ask questions and offer input. Many times I have actually incorporated their input into the proclamations that I have issued. Look, it's an age-old thing that predates my administration, but it's fairly typical for legislators to complain about communication when in fact they don't agree with the decisions that are being made. Yes, sir.
Governor, you mentioned we've seen lower numbers of cases and test positivity and that sort of thing, even after schools reopened and we're in phase 3 now. Are you comfortable with the level of numbers we've seen? You know, does that mean that we're sort of seeing the full effects of phase 3 and what that's going to bring? And
No,
you also talked more about the
first of all, I never presume that I know what this disease is going to look like next week in terms of our positivity rate. Even if we don't change our restrictions and our mitigation measures, this virus is alive and well out there. It doesn't play by our rules, and too many times individuals aren't playing by our rules either. And so I can never say I know that where we're going to be a week from now, 2 weeks from now, a month from now. I'm never going to say I'm comfortable with COVID-19 until it's gone. What I can say is the numbers we're experiencing today are a lot better than we were experiencing before we put the mask mandate in place, before we limited social gatherings and so forth. And if you have fewer people in the hospital, that's a good thing, especially as you enter flu season. If you have fewer people who are dying, that is obviously a good thing. What I will tell you is I am very grateful for the fact that we went through Labor Day weekend. We reopened our K through 12 schools. We've put college kids back on our campuses, and we have responded to multiple natural disasters, but primarily Hurricane Laura, where we've had thousands of people who have been taking shelter away from Southwest Louisiana. We've had tens of thousands of people come to our state from elsewhere in order to restore electricity, to deliver supplies, to do debris removal. And with all of those things going on, while the rest of the country, much of the rest of the country is seeing increased cases and hospitalizations and so forth, we haven't seen that in Louisiana. I can only attribute it to the fact that we were not in phase 3 during Labor Day. We were not in phase 3 during Hurricane Laura, and we had those mitigation measures in place. And I'm very thankful for that. But that doesn't mean that we're guaranteed success next week or next month. And it's paradoxical. I know it's human nature, and so it's somewhat understandable. But sometimes as we do better in our numbers, the desire among a lot of people to roll back on restrictions and mitigation measures increases, even though the only reason we're doing better is because of those restrictions and mitigation measures. And if we don't have them in place, we have every likelihood of going backwards. And so we're just going to continue to try to manage this as best we can, being transparent, looking at the data, following the science, and applying the guidelines that come to us as best we can out of Washington, D.C. Yes, ma'am.
Governor, we've now gone through our first LSU game day. What are your thoughts on compliance at that game from what you saw?
Well, first of all, I'm hopeful that game day for LSU next time will be different in a number of ways, including our performance on the field, obviously. But I'm a huge fan, and I have every confidence that Coach Orgeron and his staff and the players are going to get that turned around and they'll be ready. I will tell you from my perspective, and I wasn't at the game, but from the reports that I've seen, people did, for the most part, by and large, maintain separation while they were in the stands and so forth, and abided by the mitigation measures. And I will tell you, LSU worked extremely hard over months and months to figure out what game day would look like on its campus. And this work, you're talking about LSU, it actually played out whether it's at ULL or Tech or ULM as well. And if there's another college playing football in Louisiana, I apologize. But I'm for all of them, by the way. But there's been a lot of work everywhere to try to make that a safe experience. And the limitation on the percent occupancy is really important because you cannot physically distance if you don't have a reduced occupancy percentage. And even though you may be in the stadium physically distanced. When you are going into and out of the stadium, when you're going to the concession stand and the bathrooms, you also have to have some crowd management in place there too. And that's what LSU, I think, did extremely well. And that's what our other universities are doing. So what I expect is that they probably learned some lessons as to how things can be done better for the next game, and they'll incorporate those new additional measures into the next game's plan. But overall, I was satisfied with the game, except for the outcome. Okay, look, I want to thank you all for continuing to cover all the important things going on here in Louisiana. As I mentioned earlier, our next scheduled press conference will be at 2 p.m. next Thursday. If there's a need to deviate from that schedule, I will let you all know, and we'll have a press conference earlier. And yes, I will take your question.
Just text this. A state trooper has just been indicted on some felony charges. Do you have any confidence? Do you still have confidence that the
Would you state that again?
I will.
I wasn't able to follow your question.
The state trooper was just indicted on felony charges, and we just want to know if you have confidence that the investigation will be completed and he will be treated fairly.
First of all, it just happened. I'm not sure which trooper. I am not sure which incident. And from your question, it's going to be hard for me to answer the question other than I can say that I have confidence that what is demanded by justice is what will happen. And it sounds like from your question, there's already an indictment, which means there's a criminal prosecution underway. And so why would I don't have any reason to doubt that prosecution is going to be done properly. Yeah, I think the safest thing for us to do is figure out which incident, which trooper, whether this happened, and then we will respond. But it's going to be hard to respond to that question. Look, thank all of you. We'll see you next Tuesday at 2.